name's Hilary Hollis. I'm the Head of Nursing for Clinical Services in the Macmillan Lead Cancer Nurse in the Trust. This is my colleague Julia Lowes, who's Clinical Nurse Specialist and was the Nurse of the Year this year at Epsom's and Helier. We're going to talk to you today about some of the key facts about cancer, and look at cancer in our local population, talk a little bit about how cancer care is developing in our trust, and then talk specifically about some of the nursing developments in our trust. So what is cancer? Cancer is a disease caused by normal cells which change so that they grow in an uncontrolled way, and that can lead on to a lump called a tumour forming. Obviously, if that's not treated, that tumour can in the future cause problems in one or three ways. It could either spread into the normal tissue of the structures nearby, it could cause pressure on other body structures, or it could spread into other parts of the body, either through the bloodstream or through our lymphatic system. But we know that we are making progress with cancer, although there are more than 200 types of cancer, each with a slightly different cause, symptoms and treatment, and that around 325,000 people are diagnosed in the UK. For example, in 2010, that's around 890 people each day. We are making progress. Whilst breast, lung and bowel and prostate cancers together account for over half of all new cancers, we also know that the majority of those develop at an age over 65, which some people may describe as older. I'm sure many of us don't, but is at times described as older. But there is good news. In the time that I've been working in cancer care, I've seen many improvements in treatment and in survival. So now over half of people diagnosed with cancer survive their disease for at least 5 years. And cancer survival rates in the UK have doubled in the last 40 years, with cancer deaths having fallen by around a fifth over the last 30 years and 10% in the last decade. So there are significant improvements. But there are also things that we can do to prevent cancer ourselves. Whilst some of that is related to our genes, there's also many of the things that we experience in life, perhaps the good and the bad, alcohol, being overweight, our diet, tobacco, sitting out in the sun, are all factors that will perhaps lead to cancer developing. So as well as cancer treatment, there's much to be looked at in terms of cancer prevention. However, when we look at where we are locally, we can see that both in Surrey Downs and in Sutton and Merton, the percent of patients that are diagnosed through emergency routes are lower than the national average, more significantly lower in Surrey than in Sutton and Merton. Likewise, the incidence of cancer for our local area is below the national average, and our survival is better than the national average, and our mortality, again, lower than the national average. So that obviously sometimes varies between different perhaps local areas or wards within Sutton and Merton, and brings total averages to below the national average. Looking at what's been happening within London, cancer care in London has been changing over the last 12 to 24 months, and we have changed from 5 cancer networks within London to 2 integrated cancer systems, and we work as one of the 17 trusts within London Cancer Alliance, and work closely and are working closely with them to improve cancer services in South West London. We also have close alliances with Macmillan Cancer Support, and they support many of the posts and nursing posts within the trust. we're very involved in looking at the quality of our service, and annual peer review of all of our cancer services takes place, and we're just in the middle of doing that, either through a self-assessment and internal validation with an internal panel reviewing our services, or external peer reviewers coming in to look at our services and help us to improve them for the future. We are also involved in the annual Cancer Patient Experience Survey and have recently received our results from that, and are working to look at how we can continue to improve patients' experiences as they receive treatment for their cancer, through from first seeing their GP through to treatment and long-term survival.
I'm going to start off talking about various developments in cancer nursing in the last 12 months in our trust. First one is the acute oncology service, which is a service that's developed through a national initiative to improve care of cancer patients. And this is our team when we started out in September 2011 with Dr. Lydia Jones, who was the lead cancer consultant then. We see patients admitted with problems related to a known cancer diagnosis or the treatment of that, and people coming in, particularly through A&E and AMU, who present with a suspicion of a cancer when they've just come in having fallen or something, and some investigations revealed that there's something going on that is not quite right. We aim to see patients referred to our service within 24 hours of the referral, which we receive when it's made. And the last audit we did of that, we were actually seeing patients, 82% of those patients were seen within 24 hours. I forgot to say who the team are by starting to talk about the aim of the service. And this is our team. There's 2 nurse specialists, Dawn Brewer and myself, and we work part-time in acute oncology and in other cancer teams, and the 2 oncologists sitting at the front come work with Marsden and Epsom and St Helier. The nurses are the key pin really to the service, because we're around 9 to 5 Monday to Friday, although we do two jobs, and the doctors come from the Marsden every day and visit patients that are referred to us on the wards with us. But we can ring them if we need them and get advice, or if anybody needs advice, really. It's really about liaison and improving experiences for patients. We see approximately 80 referrals a month, which equates to about 4 referrals a day, but some days we don't get any new referrals and other days we get 8 to 10, so it's a very varied day we have. 40% of the people referred to us do come in with problems related to their known cancer diagnosis or the treatment thereof. And so, for example, last week we had a patient came through A&E with sepsis, and she got her antibiotics in 5 minutes, cannulated and antibiotics in 5 minutes, when the target we're aiming for is an hour, because we know the quicker people get their antibiotics, the better. The less time they spend in hospital and the quicker they recover, really. So that's one example. And 60% of the patients we see are actually coming in with a suspected new cancer diagnosis. Don't all turn out to have cancer, but there's a suspicion, so we try and make sure they get the treatment, the investigations they need quickly. And again, I had an example from a couple of weekends ago. A patient came into Epsom through A&E, was being investigated at home, through outpatients for a suspected cancer, and actually was seen on the ward by our consultant on the Monday, and was then seen at the Marsden in the appropriate clinic for that type of cancer the next day. So that's just a couple of examples of where we make a difference, really, the service. This is actually the palliative care team. I'm sorry, Dr. Noble, we didn't have just clinical nurse specialists. We know through our satisfaction surveys that nurse specialists are key to patients who want to just be able to talk to somebody if they have a concern at any point. And I can certainly testify to that. I have some patients and carers who need much more support like that than you know, other people, but we do have key nurse specialists for all the cancer teams that are involved in this trust. All I can say is I just know that it makes a huge difference to have that phone number you can ring or text a message so that you can get a phone call back when you need it from anybody. And we have teams of nurse specialists in lung, haematology, urology, palliative care, and we look to expand to anywhere we really need services for our cancer patients in the future. One of the other national initiatives that we've got involved in this year is the Holistic Needs Assessment, which is about trying to make sure that we're meeting the needs of patients, you know, that we meet, so that it's about what their problems are and not about assumptions we make. And the idea is that this assessment is made within 31 days of their first diagnosis and then at key points in their treatment pathway. And it just to make it better, really, to, like I say, treat people as individuals and sort out their problems and not make assumptions about what they are. And another thing that the colorectal nurses have been involved in is setting up nurse-led clinics last year, and they actually audited this, and these are the sort of things that people say to find out how they, if they, you know, what they thought of it. And having this service has made a difficult situation more manageable. I'm very happy with the service and the follow-up. The specialist nurse has always been on hand to answer any questions. I think they were quite pleased with the outcome.
We're also very keen to develop our staff and to ensure that we have the workforce we require to meet the needs of cancer patients. So we've developed close relationships with the Royal Marsden, Surrey University and King's College to ensure that staff are on a schedule of courses around some of the specialist areas where we deliver care, such as chemotherapy, haematology, acute oncology, physical assessments, and have nurses undertaking degrees and master's level study to meet those needs. In addition to that, each of our cancer teams has a nurse who's designated to take a lead on psychological care for the patients that are coming through that service. But in order to do that, we realise that they themselves need to receive support to manage situations that are often difficult. So in order to do that, in the last 12 months, we've set up supervision for our nurses with 2 of our specialist social workers, and that happens monthly so that they can bring particular cases or situations that they've been working in and can learn from that and seek support. And that then enables them as nurse specialists to go out onto our general wards and clinics and support some of the nurses there to care for and treat patients that have cancer. And then finally, we'd like to let you know about our patient information services, which we have at both sites, here at Epsom in the Butterfly Centre in the Bradley Wing, at Epsom and at St Helier in the Springle unit. And these are centres that have significant amounts of information about cancer and also cancer prevention, so that it's not just for patients with cancer, but it may be people who are worried about any aspect of either cancer prevention or getting cancer or have relatives. And we were fortunate this year for our Macmillan Butterfly Centre at Epsom to be awarded the Macmillan Quality Environment Mark, which gives our patients reassurance that the unit is to the standards that would be expected for such a unit, and we'll be working towards obtaining the same mark for our St Helier Centre next year. And in addition, our staff and volunteers who work within these units were lucky enough to receive the Patient Choice Award in 2013 for all of the work that they do, many of them in their own time, to meet our patients' needs. So Julia and I will be around afterwards, so if you've got any questions, we'd be delighted to answer them, and thank you for listening.